Now let's talk about health and hygiene and the importance of this in a disaster situation. Whenever you go camping, for example, if you forget to bring one of those sort of essential things that you're going to need on a day-to-day basis, like toilet paper or a toothbrush or something like that, you're going to notice it pretty quick. So there's nothing like backpacking and really going into the backcountry to train you on what's important and the need to bring certain things with you. So that being said, let's talk about what I'm bringing with me to address health and hygiene. So let's start with hygiene. First thing is a full roll of toilet paper, smushed down, fitting inside of a plastic bag. TP, that pretty much goes without saying. I'd like to have the option to do that, and not having it would be pretty much a pain in the ass, no pun intended. I also have a little mini thing of tissues here. I think that's pretty important as well to blow your nose, etc. As far as hygiene goes, I actually have a full bar of soap here enclosed in a plastic container. Soap is super important. You gotta wash yourself, keep yourself clean. You'll prevent a lot of health problems that way. We all know that in the city, but that's equally important, if not more so, in a disaster. I also have a toothbrush here with a container, a little tube of toothpaste, and also a washcloth. I think that with just that tiny little system there, I'll be able to keep myself clean and pretty happy. I also have some wet ones here, just for like a quick way to clean up your hands or your face or whatever. Pretty cool. Last thing I'll say, it's not exactly hygiene, but I would say it's part of good health, some earplugs, and that is kind of a debatable thing to bring because it's going to take away from your ability to defend yourself perhaps because you won't hear somebody approaching. But if you say that you're, Hurricane Katrina, you're in the Superdome or whatever with all those people or in some sort of a shelter or something, and you can't sleep, you know that there's no security threat, but you're crowded around by tons of people, something like this could really save your life, Sleep is super important, so I want to have that with me. Okay, now let's talk about my first aid and sort of health capabilities that I have with me. So I do have a first aid kit, and it's kind of busted open here so you guys can sort of see what's in it. I'll just talk about a few key components. So I've got some bandages here, just some regular band-aids. I also have a bandana, which could be used as a tourniquet for sort of larger wounds if need be. I have some maxi pads, I guess, woman hygiene products, and those are good to absorb, obviously, a lot of blood. So I've got 2 of those, and I think that those could be very important and really easy to find and buy. I've got some duct tape here. Somebody actually commented on one of my videos in the Book of Eli. He uses duct tape for first aid to repair a gunshot wound, and I sort of made fun of that. But somebody who says they're a healthcare provider says that duct tape can really be used effectively in first aid situations. So I've got another credit card wrapped with Gorilla duct tape dedicated to the first aid kit. So that's awesome. I also have some medical tape here wrapped around half of a credit card. It's pretty cool. I have some antibiotics here. I actually got these prescribed to me by my family doctor when I went down to Mexico. They expire in January of next year, so I'm probably going to have to get those replaced at some point. But there's a full course of antibiotics there. They are ciprofloxacin. People who know a lot more about medicine will know what that means. But anyways, antibiotics. If I get an infection, I've got a full course of treatment there that lasts for basically another 7 or 8 months past now. I got some antiseptic wipes here. Those are good if you have a wound, just to wipe away any sort of bacteria, etc. before you bandage it up. I have a little container here with a variety of medicine in it. There's not too much, but there is Tylenol, Motrin, aspirin, and loperamide. And that's basically the anti-diarrhea medicine. So yeah, just a few common medicines there to deal with aches and pains and upset tummy. Here's a little bit more of my first aid kit, all broken open here. I keep my water disinfection stuff in there. I've got some Q-tips. Here's another one of those wipes, throw it over there. I got some cotton balls, some surgical gloves. I've got a lighter for cauterization purposes or disinfecting like a cutting tool or something. I have some iodine in there, also a topical disinfectant. More gloves over here, more plastic gloves. I think I probably have 5 or 10 pairs in there. It's probably overkill, but that's pretty important, I would say. I also have a dust mask here. I guess that could be used to sort of keep yourself from sneezing and coughing onto people, or keep somebody else from doing that to the group or whatever. Not too sure what I would use that for, but it's there anyways. And yeah, of course the bandana, which could be used over your face to prevent yourself from breathing dust, etc. So yeah, that's more or less my kit. And the last thing I'll mention, of course, is my this manual, the SAS Survival Guide. I probably should have mentioned this on the shelter video as well, but this is a wealth of knowledge. Like, there's so much stuff in there, all these different chapters about different subjects. But there is one about health, and it does discuss first aid and various types of remedies and things like that. So, like, here's emergency childbirth and stuff. So I will be first to admit I'm not a first aid expert. I have taken a course in it, and that's the other last thing I'll mention too, is like, all this first aid stuff is not going to be very useful to you if you have no knowledge to back it up. So along with any first aid capabilities you have in your kit, you should supplement that with knowledge and get a good first aid training. I took my course about a year and a half ago, and I'm actually scheduled to go and renew that. I think it's still valid for another year, but one day a year learning first aid is totally insufficient in my opinion. Like, at least once a year you should go for a course and just refresh your knowledge and study in the meantime. So that's definitely something I plan to do. Anyways, that is my first aid and health and sanitation capabilities of my bug out kit.